We'll just press record.
Yeah, and everybody is happy for the seminar to be recorded. Okay.
It can also be reviewed, guys, as well. So there are, you know, we can, like, if anyone's nervous about anything, but don't just, no, we're not here to catch you out. Everyone's just so excited to have you all in a room. And please don't, we're here to support you. Like, we're going to put resources up, that Pell thing that Robin gave us and all of that, all of those resources will be put on there. Gav, if you're happy for us to signpost your stuff, we'll do that as well. Yeah. So if you think of it, it will happen in the background, so don't worry about it. So lovely. I am going to, it takes a while for them to come into the room, guys, so just bear with me. I'll do some spiel at the beginning, don't worry about that. I'll do an introduction, and Phil, I will formally hand over to you, so there is a very clear handover period. At the end, I apologise, it's all very abrupt. I push this button and it just ends. So I will not get a chance to get back into a room and say that I cannot thank you enough for taking time out of your busy lives to do this. And a lot of people in the audience will feel the same. So thank you very much.
Yeah, thank you.
Thank you, Meg. And thanks for getting it all together.
Yes.
Right, okay. So Alicia, what I would like you to do is, hang on, what she says, I would like you to push the orange button now.
Okay, we are now live.
Lovely. Now, as I wait for my room to fill up, I am just furiously making sure that we are also streaming this to Facebook. So apologies if I'm looking at 100 different screens at the same time. Perhaps Alicia will tell me whether the Facebook thing's happening. If someone can just go and have a little look at the Facebook thing.
It is working, Meg. We are now live.
Lovely. So welcome to our Facebook followers. That's brilliant. I'm just going to let the number at the bottom settle a little bit before I begin my introduction, so nobody misses anything. We're expecting a full house or a lot of people today, so I'll just wait until you all get into the room. Welcome to the land of Facebook. I'm glad we could make this available for you today. There's a few buttons that you've got to push that I had to work out. You'll have to bear with me. I'm not as young as I once was with all this button pushing. Lovely, that seems to be settling now, which is fabulous. So I suspect the number will rise as we begin to get some late people coming through. You'd be very welcome to join us. We'll be here until 5:30. So hello everyone, and it's great to see so many of you here today. There are some people that can't make it, including our very own Robin Townley, the ABTT Chief Executive. He's on furlough, but he has asked me in his absence to extend to you all a very warm welcome. He offers his best wishes and the hope that we take away something stimulating, useful and helpful from this programme of seminars, in addition to the companionship that coming together provides. I'd just like to echo all that Robin has said and now formally welcome you on behalf of the ABTT to this seminar session, Raising the Curtain, Working Healthy and Safe Post-COVID-19. Before I hand you over to our seminar host, let me go through a little bit of Zoom housekeeping webinar advice for you. Firstly, you may find it useful just to pop up to the top right hand tab and switch yourself from speaker view to gallery view. This way you'll be able to see all of our panelists, and there's a lot of them on this panel. So just make sure that you can see them all at the same time. There are two ways that you can join in with today's seminar. Feel free to use the chat function at the bottom. Have a little click on that. Let us know where you're coming from today. I know that there are lots of people from all across the country, and we've had lots of international people joining us. You're all very welcome. Let us know where you're coming from. You're also welcome to voice your own opinion in here. The panelists can see that. However, if you have a question, I'd ask you that you put that in the Q&A tab. So there's also another button at the bottom. Just click on that Q&A and you can pose your question. If it's for someone specifically, just make that very clear at the top and they will be able to do it. I would just like to also point out that there are a lot of you and there'll be a lot of questions, and it is inevitable we are not going to get to them all. But we think that there's a way of keeping all these questions, and we're hoping to be able to archive them and put them all together. So lastly, it's just a reminder to the panel and to everybody that we will be recording this session and posting this online. And I think the land of Facebook saves it as well, which is great. So it will be available as a resource later on. I just want to, it just remains for me to hand over to the chair of this seminar today, Phill Brown.
Hi, good afternoon everyone. I'm Phill Brown. I'm the Head of Risk and Safety for SOLT UK Theatre, but like a lot of people, I'm also currently on furlough, chomping at the bit to get back to work. I'm not going to talk too much, but I'm just going to kind of set the scene about what we want to cover with the seminar this afternoon. It's probably fair to say that this crisis is a challenge for everyone who's working within our industry, whether they're working front of house, back of house, but also for the ancillary service support organisations that we work with as well. And I guess what we all want to know is when we can get back to work, but also how we can open as quickly as possible. Some venues are already starting to open in Europe and internationally, and I think we're going to cover that a bit later on in the seminar. But for me, I'm kind of quite keen to know what opening is going to look like. You know, are we going to have screening devices? Are we going to have electrostatic spraying? We're going to have obviously ongoing social distancing, whatever that distance might be. And obviously then we might end up with more layers of policies and procedures. We clearly have to make sure that we're going to coordinate and involve our staff, whether front of house and back of house, and also our audiences about how the venues are going to be safe and how they're going to feel safe when they come back to the venues when we eventually do open. But I think it's also imperative that when we do open, that any laws we introduce aren't going to have an impact on existing legislation or procedures and protocols that we've already got. The existing things that happened before this crisis are still going to exist, and we need to make sure that anything new that we put in place isn't going to compromise those issues as well. But what is clear is we're going to have to do theatre differently. And so what the ABTT have done, we've assembled a diverse but a great panel of optimistic experts who are currently all working to try to tackle some of the issues that are affecting our industry. And I would add that all the opinions that they're going to give today are their own opinions. They're not representing any departments of government, and obviously they're not going to go into too much individual details about what they might be doing at their own businesses. This is purely their own opinions that they're going to cover. But hopefully some of the issues that we know we've got will be addressed with the discussions this afternoon. So I'm just going to go quickly through who we've got on the panel. We've got Stu Beeby and Stuart Graham, both from ATG. We've got Richard Bunn, who's from ARUP. We've got Gary Wright, who's from Charcoal Blue. We've got Tom Goode from Goode Productions. We've got Gav Pell from Pirate Crew. And we've got Emma Wilson from the Royal Opera House. We've also got a couple of the ABTT team, including David, who's going to be hovering in the background supporting us as well. So we want to make sure that everyone gets as much out of today as possible, and we want as much engagement as we can. So I'm going to shut up now, and I'm going to pass over to our first speaker, who's Stu Beeby. And hopefully Stu is going to give us an update on the current situation, but also the ongoing discussions that we've been having with government in regards to how we can reopen safely. So over to you, Stu.
Thanks, Phil, and good afternoon, everybody. What's the saying? It's nice to get us all in the same Zoom now, but lovely to see so many of you coming in, and we can see it flickering away at the side as everybody's saying their messages. I'm going to throw a lot of names and titles in, but I only say that for one reason, really, and it's to give you a good idea and a warm feeling and many reasons to be optimistic about how many people are working through the challenges of how we reopen our business and how we are COVID secure and get our sector back up and running. So forgive me, but I'm going to start at the top, and a lot of what I've got, I'll steer you to further detail that you can find on the web, should you wish. But at the very top of this, as you know, we all sit under DCMS for Digital, Culture, Media and Sport. You are right to think it was a bit quiet at the start of lockdown because they focused on sport in terms of a sector that they needed to get back going. But that was to our benefit because when they decided, right, it's now time to set up the cultural renewal task force, and our part of the ship all comes under another one, the Recreation and Leisure Task Force. All of the scientists, all of the medics, and all of the people that were used to deliver the roadmap for sport were brought in to our part of the business. Now, on the cultural task force, you'll have seen it in most of the media, but it's sat there on the government's website. But huge representation there across the industry, from talented artists, entertainers, people like Lord Grade, who of course ran the BBC. My CEO is on there representing a very broad church as well. But we've got Alex Scott, we've got Tamara Rojo from English National Ballet. There is a very broad panel there. Under that is then a series of working groups. And why are there so many working groups? Because this is a very broad sector. And as I've touched on with, recreation and leisure, there are a lot of people to bring together, not just to try and make sure we are collegiate and collaborating, but in there are lots of brain cells with people who can either solve some of these challenges or have got experience because they're already operating in somewhere as successful as, say, South Korea, where theatres have never been closed, and they've learned from 2 previous pandemics with SARS and avian flu. But under there, and where are we all working together, and where's the ABTT fitting in? Basically, we have a group that feeds straight into that cultural task force and the ministry. And that's the entertainment and events group. And Julian Bird, the chair of SOLT UK Theatre, he's the key lead on that, speaking into government. But under there are a number of working groups. And to give you a flavour again of how many people are involved and how much horsepower we're bringing into it, so that we can shine the light on it and shine brightly, because there is a way for us to get back, absolutely. But we've got a group that is looking at opening the venues safely and how we operate COVID secure. There's those looking at touring. There's those looking at rehearsals and casting. There's a group looking at insurance, and all of these various groups. I've only touched on a number of task forces. There are the usual boards as well, but all of these are looking at a way of guiding government so that we get guidance that is broad enough for us all to go away and take into our own specific businesses, our own specific venues or performance spaces or concert halls, i.e. it is not so prescriptive, it won't have exceptions. It is just like you saw with sport. The guidelines came out and each sporting body went off and said what it would do for rugby or cricket and so on. And we're doing a lot of that. Of course, we have our challenges. Singing and musicians, those with woodwind and brass. There's some real challenges here because of the amount of particulates that could be in the air for people. But we're then looking at delivering on 2 phases, and this is where I'll sort of surmise. All of that effort is to get us to our first set of guidance, which is the performing arts returning to training, rehearsal, and performance, whether it is live or streamed. That's section 1, and we really do hope to be putting that first guidance from all of these groups to the government and out to consultation by the end of this month. There are some, not a lot, but there are some key scientific bits we want, particularly around musicians, to help on at present. And then the second body of work will begin, and you'll understand why it's in this sequence, because then we'll look at touring. Because a lot of the things that we will discuss today as sensible ways of working for COVID secure are made significantly more challenging with touring. So it makes sense that we unlock training and rehearsing and performing before we're into the logistics of when that is all traveling around the country or around Europe. But there's lots of people involved, lots of great minds, some phenomenal work and collaboration going on, and there are many reasons to be excited about us coming back, but equally be pragmatic that with what we do, there are some challenges, and as long as social distancing is number 1 for fighting the virus, that is going to give us some challenges for opening the doors and doing what we do best. Phil, thanks very much.
Right. It's probably a good opportunity now I'm going to change my order a little bit, and I'm going to put Gav on the spot, unfortunately. Just because you mentioned kind of get-ins and get-outs and the touring circuit. Gav, I know you've been working on an excellent document which is looking at how your crew and your staff are adapting and working in the crisis. Can you just kind of give us a flavour of what kind of issues you've been covering as part of that, please?
Yeah, absolutely. Hello to anyone who knows me. My name's Gav Pell. I'm the co-owner of Pirate Crew. I'm incredibly nervous to do this. I'm nervous because I'm amongst esteemed guests. We've got 500 people in front of us, but we're talking about the most important thing to all of us at the moment. That's what we're discussing, and that makes me terribly nervous to be on this panel and talk about that. We have been asked here to talk about the work we're doing. When COVID first hit, when it hit Italy and Spain, me and my partner Rob realised what it was going to do to the industry, or when things shut down, what it could do. At that point, we offered all the pirates out at cost, and everyone thought we were doing a good thing. We kind of were for the industry, but we were also doing it to make sure our crew got a payday, the last payday before they were locked down. So that was the kind of first thing we did. After that, we were in a lockdown situation, and after a couple of days sulking and feeling sorry for ourselves, we kind of decided to take ownership of what we could do. Like, it wasn't our fault. COVID wasn't our fault, but how we responded did. So me and Rob sat down and wrote a document about Pirate Crew, about what we could do when we were back. We were in a quite unique, maybe, position, as that because we do so much different work in the theatre, we have risk assessments and method statements on nearly everything. So we looked at all of those, and we could have changed all of them to working under social distancing, but we decided a broader document would have been a better and easier thing to follow. So we wrote a 9-page document on what our crew are doing in theatre, what they should do, how they should behave. You'll excuse me, I'm just going to look through my notes. Me 2 ticks. We kind of decided first off we had to prioritise what was important. We felt that the most important thing that we could do was make sure that we didn't spread one case of COVID-19 while we were working. That was the most important thing, that we and the people we were working with didn't spread COVID. That was number 2. We had to make sure that on top of that, the health and safety of everybody we were working with and all of our crew was as important as it always was before, not just because there was COVID around. And 3, we realised that we were going to be working when other people were furloughed and when freelancers were off doing other things, and that it was important to keep the standards of theatre up as high as possible. So we were caretaking, we were looking after other people's jobs, and we had to do a really good job because of that. And that kind of leads me on to, while we're out working, we wanted everybody to know that we're not out trying to take anybody's jobs, we're just caretaking for the industry. So I really wanted to say that in case anybody thought I was out here boasting about the work we're doing. It's not like that. So the work that we're doing at the moment, so today I've got a group of people at English Toy and Opera's warehouse, and we're unloading sets that have been stuck on in back of trucks, and we're unloading those. I've got my the Milton Keynes team doing that. The same team last week were on stage at the Hornchurch Theatre. They had a set that was stuck on stage. They need to remove it on stage so they could use the space in a socially distanced way, so they could make a bigger space. So we sent a team in to do that. Why I mentioned both of those is we had the same people working together all the time. So we have what we call lifting teams. If you've got 8 people, you split them into 2 for lifting. So number 1 and 2 are always working together, so they're not spreading anything they've got between 7 and 8. That's kind of how we're working it, and all of the different departments and all the different regions are doing exactly the same. So in London, for instance, we've had 16 people working, and they're the 16 people I'll use until somebody needs more than 16 people. And number 1 and 2 will always lift together, and they will lift with number 3 and 4 if it requires more people. That's kind of how we're keeping our number down when we can't be 2 meters apart, if that makes sense. On top of those jobs, I'm trying to think of some bits and bobs we've done. We've got, we've been helping out our friends at New Adventures for Matthew Bourne. Jenny Green asked us to come and unload, so we've been loading trucks that have come from abroad, that were stuck abroad. We've been helping put those into storage, which is great. We've been in the Piccadilly Theatre in London, helping take lights and and sound down, which was great because it was a different department. So we're working our protocols from different departments, and we did the same at Trafalgar Studio, which was pretty good. We've also, our teams out in Bristol have been helping out BKL, exactly the same thing. They've had shows come back from abroad that otherwise would have been stuck in trucks and they couldn't get to them. So we've been unloading those, storing and cleaning, as we were talking about earlier. That's the kind of work we're doing and the protocols we're working under. So I'll pass back to Phil.
Right. Just want to bring Stu Graham in for a second there. Stu, I think we probably need to have another review of our code of conduct for get-ins and get-outs document that we thought we'd just finished prior to all this starting.
So it will certainly have something added into it in the future. Yeah. I just wanted to pick up with Gav, because you talked about the Piccadilly, and I was on site with your with some of your team on Thursday and Friday while we were doing that work with some of the production equipment. Have the feedback from your team to you, Gav, how much change they feel there was on site?
The good thing is it's very positive. I'm old enough, and you're not, obviously, Stuart, to remember when boots and hard hats were introduced to the industry, and we had a lot of pushback. People didn't want to wear boots and wear hard hats. With this, from my point of view, and all the people we've spoken to are very happy to work. They're just happy to work, so they're working under any conditions that we're demanding. There's the wrong word, that we're asking them to do. So the guys that I'm working with, my guys have been very happy to work like that. We've had a little bit of pushback from different venues, obviously not the Piccadilly, where masks were provided and people didn't wear them. And we've had, we're really trying to have a lot of forethought in what we do. So you're not double handling, so people aren't holding on to things for a length of time. So that, and sometimes some people are a little less keen. They want to just pick it up and do something with it, rather than that's the only negatives we had. So far, it's been very positive.
Because, you know, for at these early stages of people going back into venues or loading trailers or going into the workshops, those early principles of people thinking they're going to have to distance whatever that meterage is in the long term, and cleanliness and cohort working, it's all going to become a behaviour of everyone on site. And your document is written really clearly to your team, and I love some of the language in it. But it's those behaviours which are going to instill really early, and everyone's going to have the importance of everyone going onto site and being able to feed back into these early documents are going to be really critical. So your 16 people on site at the moment regularly are going to be really key to you shaping your own guidance. But for us to be able to bring that back into these, as Stu said, there's going to be some broad brushstrokes for how the industry operates back of house, and ABTT and ATG and Pirate Crew and all the other organisations out there are going to help feed those operational standards. But the behaviours of those on site now are going to be really key. Yeah, absolutely. We remind our guys about that before every shift. First off, we check they're not ill before they go on site, and we're reminding them that exactly that their behaviours are what people are seeing, and people are watching. The industry, there's 500 people watching us now. The industry's watching, so we have to. If we can make our behaviours almost perfect, then when people filter in, it will become the norm, the new normal, as people say. And you're already on your second. Oh, sorry, Nick.
No, I was just going to say that, like everybody else, Gav very kindly sent me his working method statements and documents. There's a lot of people that are saying that they'd very much like to see those. You've been very kind to share it with everyone here. I'm assuming that you're open to the notion of releasing them, if that's possible or not. Absolutely. We'll put them out on our website in the next couple of days, but feel free to share. Anybody who's got it, feel free to share it. When we wrote it, this is me and my business partner, Rob, I'm not taking all of the credit. We expected it to be the start of a conversation, that we would have more pushback maybe. We've adjusted it a little bit as we're working. But we like criticism. We'd like people to come back and say what they think's wrong with it, or what's right with it, what works and what doesn't, and what we've missed out. We'd really like that, because then it becomes a fuller document that everybody can use.
Great. I'm going to bring in Tom now. So Tom, from a health and safety perspective, we've already had quite a bit of chat about what new procedures and policies might need to be brought in. Can you kind of give us an overview of some of the projects you've been working on over the last few months that might help?
Good afternoon, everybody. I think obviously we've had some very useful information straight away from Stu about the sort of top line strategic stuff, and then some equally useful and relevant information from Gab about the front line, if you like. What I think might be quite useful is just to briefly have a look at the bit in between as well. And certainly I'm conscious of an awful lot of work that's happening in between the top level government guidance and the individual employers' approach to what they're doing. So obviously there's the government guidance that's generic to particular workplace types, which I'm sure most people are familiar with. If not, it's very easy to find on the internet. The next level down was the departmental government guidance for the specific sectors, which Stu's talked about. Hugely challenging because, as he said, they're so broad and there's lots of different stakeholders with different requirements from that. So a big challenge and not a quick thing to do. Below that, and waiting for that in some cases, there's also a whole level of sector-specific guidance that's either been drawn up already or is being drawn up by different stakeholders within the different sectors that we work in. Broadcast have already got some good solid guidance up and running for going back to their studio work. That's been put together. Again, not an easy process because there's so many different stakeholders involved in that. Will be various objectives that are trying to be met. There's other guidance which I'm aware of which is underway. The Event Industry Forum is producing guidance for the outdoor event industry. There's film and TV. The British Film Commission have produced guidance for the film and high-end TV drama output. The AEO and the EAV are producing guidance for exhibitions and large fairgrounds. Not published yet, but that's work in progress. So there's plenty of that middle ground guidance, which will then help the employers who have to produce their own new policies, procedures and whatever, interpret that strategic level guidance, the guiding principles, if you like, that Stuart Beeby talked about, and put that into place for their own particular undertaking. There's a parallel as well with the construction world. The construction aren't looking at return to work protocols because they put guidance in place very early to enable them to continue working. And the Construction Leadership Council have put, I think they're up to version 4 now of their guidance in terms of working on construction and outdoor workplaces. Now, we're not construction. We should be very clear. We are not the construction industry. However, there's a lot of the information that they've produced that is relevant to the type of work we do, particularly during the fit up and the strike period. So there's useful references that we could learn from in terms of that. They're on version 4. They've been going through this for 3 months in a practical sense. So that's a useful resource that we could be tapping into just to see how it might work for us. So I think when it gets to the employer's guidance that everybody needs to produce for their own workplace, their policies and procedures, in a way, that guidance is a bit easier. And in other ways, it's a bit harder. The reason I say it's a bit easier, there's fewer stakeholders, fewer different objectives to have to try and accommodate. The employer has control over a lot more than any of the strategic or sort of middle sector guidance organisations. There's a familiarity with the workplace and the undertakings that are being carried out. And there's an autonomy to produce that guidance for yourself because it needs to suit your own objectives. Where it's much harder for them, I feel, is that far less likely to have access to the really top level competent medical advice, which is why it's really important that at the strategic level, those guidelines that we get given, those guiding principles, include the sort of information that we need to apply in terms of that medical or clinical advice, because we won't, an awful lot of organisations will not have the resources to commission that type of work. There will be concern with employers that they might not have the competency in-house or uncertainty about the degree of control measures that they need to be putting in place. to fulfil the reasonable practicability requirement, which is common to this particular issue as it is to any other area of health and safety. So in that sense, the uncertainty of an employer makes producing those guidelines a very difficult thing for them to do with any confidence, unless the preceding guidance has been clear and relevant. And the most important part of all of those bits of guidance is that they are enabling. If they're not designed to be enabling, to allow you to find a way to do your work, then they will not really be fit for purpose.
Great. I just want to say to everyone who's sending questions, we're not ignoring the questions. We'll try to get to something, but I want to get through all the panel as well before we start answering some of those questions. So I'm going to, Richard, I will come to you in a bit, I promise. Emma, I want to kind of come on to you because I think it follows on quite nicely. Tom mentioned kind of the employers and kind of what the employers' responsibility are. And I know you've been doing some great work at the Opera House in regards to kind of what you might have operationally wise for when staff are coming back in. So can you kind of give us an insight into what you've been working on there? Would that be okay?
Yeah, and I've noticed a couple of questions coming in as well about that, about what we're doing. So throughout the last 3 months, we've had minimal facility staff just keeping the building ticking over, a couple of security, but really we're just talking about 3 or 4 people. And then each month we've had 1 or 2 people coming in, well, in pairs actually. Fly system, keep everything moving, electrics, do a soak test of all the rig and make sure the dimmers are okay. And there's a really stringent procedure in place for that. So there's several steps of agreement. So there's risk assessments have to go into place, the facilities have to agree to that, security has to agree to it, you know, so on and so forth. And then there's a risk assessment that they all have to follow about social distancing on site, about bringing all the food with you, about you clean your own bathroom after you've used it, things like that. This is for really minimal numbers of people in a really big building. We're about to go into a new phase. So we've got on the 13th, this Saturday, and then 2 subsequent Saturdays, a sort of live from Covent Garden. So it's going to be on Facebook and YouTube, and it's going to be broadcast live. And so there's a bigger team on you know, in for that. There's a broadcast team, sound team, technicians, musicians, dancers. So there is a whole process, and I can't take credit for this. This is obviously facilities and health and safety there, because it is an organisation that does have that expertise on board, which we're very fortunate for that. And there is a whole process. So if it would help people, just for me to just talk that over briefly. We've also got documentation, obviously, for all of this, which we will be very happy to share as well. They are evolving documents, obviously, because they will change next week and the week after and the week after. But if any of this detail is useful for people, then we are really, really happy to share that. So broadly speaking, you've got, before you even come to work, you've got to be the self-checking, reporting, doing all of that yourself. There's the travel to work, which is also, we've got certain strict guidelines around that. But then when you get to the building, we've got several steps that you go through. So we've changed the entrance. There was a question that earlier said, is this going to be the same for audiences, the same for backstage workers and audiences? It's the same control for absolutely everybody. We go in through the front entrance, so there's no stage door or back entrances or small corridors. All through the front entrance, security are there. Your thermal temperature check, there's a thermal camera up. Now, I know that's not necessarily in the guidance, but it's in an abundance of caution for our first events. That seems to be a good thing to do. And because there might be personal reasons why you might be hot or you've just cycled in, then there is a large spacious area which you'll be asked to wait, and then your temperature will be taken again if it's above a certain level. If it's still after a couple of readings still high, then you'll be asked to go home by the safest method. But if not, then we proceed into the building. Bike parks are in the foyer. So again, not down in corridors, that's all being set up in the foyer. And there's a one-way system. The first thing you will do is go to a specific set of toilets, and everybody washes their hands. Only at that point are you then allowed to continue into your workspace. There is a big chart that we've all designated which rooms we need to go into. And that's really important for our cleaning staff, obviously, because they need to limit the amount of rooms and spaces that might be hazardous for them to go into. So, for example, I'm going to go into the office I work in tomorrow to pick up some personal belongings, some work boots, but then I don't go back in there on Saturday. I will already have them with me. So again, it's just minimising your contact with as many spaces as possible. There's one-way systems around the building, which are all signposted. We've had a couple of people into this week already who've been doing taping, signing and everything around the building. So we follow a one-way system for staircases and lifts and all the rest of it. And then you stay in your cohort, you stay in your group. So if I'm working with a group of, say, 4 persons on stage, we would take a break together. There are break areas, and we're very fortunate at the Opera House. We've got space, I know, but within those large terraced areas, then you stay within your cohort. You don't then mix more freely. Even within your cohort, you then maintain distancing, obviously. There are certain things where people are together. So there's 2 dancers, obviously, they're going to be close, but they're a couple and they live together. And the same when you see musicians or dancers on the screen, if they're together and if they're close, and if they're closer than 2 meters, then it's because they live together. So they're a household and we can treat them like that. We have, if you have to be 6 meters away from a singer, if they're singing directly at you, or 3 meters to the side. So there's all sorts of measurements going on. CAD plans are being done for exactly where everybody stands, including camera persons as well. So it's been very carefully monitored. We have staggered arrival times. I've got 7:30 slot tomorrow morning, which is my arrival time. And they're in 10-minute segments, and only a few people are arriving in each one. So it's to spread that kind of risk of mingling. And then on site, we've got monitors. So 2 senior members of staff, one for the artistic and one for the technical. I'm the technical one tomorrow. So if there are any concerns about anybody's behaviour or anybody's wellness, then those are the people that you go to take immediate action. If there's first aid needed, you call security. It's not administered personally. If there is a cleaning regime required because somebody has been sent home with suspected CV-19, then there is a whole process for the cleaning team to follow and to treat their cleaning materials as hazardous waste and so on and so forth. So there's some briefing notes being issued to staff. There's a whole risk assessment for the entire site for every activity, and then supplemental ones for each department. So broadcast have got one, orchestra have got one, technical have got one. And then they've all been shared and everybody's obliged to read all of those before they come to site. And then you have a briefing when you arrive on site as well. So they're revolving documents and we're really happy to share them. A lot of the words won't make sense because it refers to certain corridors and stuff, but if they would be of use to people, we'll be really happy to.
That's great. Thanks, Emma. I'm going to bring the last 2 panellists in, Richard and Gary. So obviously we've heard from Emma talking about some of the issues that she's bringing into the Opera House. Can you give us a kind of an insight into what our future buildings might look like? Perhaps bring in some examples from international venues where they've opened successfully and they're carrying on working in this crisis. Would that be okay?
Yeah, that's great. Yeah, thanks, Phil. So there's an interesting map, which is the Pell map, which shows where venues are across Europe and where they are opening. And I just thought it'd be useful to share a few perspectives that we're seeing at ARUP from different parts of the world, recognising these are different contexts, both in progression of diseases and also the political and regulatory conditions that are there. Gary Wright is here from Charcoal Blue, and we've been talking about and comparing notes on short, medium, long-term adjustments that needed for technicians, staff, auditors, performers. As we heard earlier, it's all the users of these spaces that need to be looked at. He was reflecting on the situation in Hong Kong, where venues are just starting to reopen. And as Stuart was saying, this is a region that has a precedent. It has a memory of SARS from 2003, and that brings the understanding of hygiene, cleaning, face masks, social distancing that we're all just getting used to over here. One example of this is a sort of a ticket and collect bar operation was introduced back then and remained in place since SARS and helps mitigate that interval crush. Stuart also mentioned in the same region, South Korea, Phantom of the Opera continues, helped by very proactive health checks, tracing, quarantine measures.
Richard, I'm happy to share that Pearl screen. I'll put a link in the chat, but just
yes, I think it's oh, perfect, brilliant. So
it does push the panelists to one side, but just have a little look at it, talk about it, and I'll get rid of it.
okay, I think it just demonstrates how we're moving at different rates. The grey blob on the UK is means that we're a little bit behind the curve, which means that there are good reasons to be looking at what's happening elsewhere. So, a couple other examples from our experience. Live concerts have started again at our Harper Concert Hall in Iceland. They're using a cohort or bubble system. They've built back up over recent weeks to full orchestra performances with musicians playing side by side, so that problem of woodwind and people blowing, which you think of an extreme case, can be addressed. Darwin, Australia, there's the Brown's Mart Theatre, which proudly claims to be the last to close and the first to open over there. It is started by reconfiguring its space using play readings, smaller casts, to facilitate that increased social distancing and gain capacity. I think the interesting thing about these examples is the way they built back is step by step. So as the risk management gets in place and that works well, that's running in parallel with the confidence of audience wanting to return in greater numbers. It's also important to note that they're subsidised spaces, aside from the Korean example. So very different from commercial operators who may not have that luxury of support getting going again.
And I think just to complement what Richard was saying, there are three stages to consider during this process. If we look across to those other pandemics of MERS and SARS, and even further back than that in terms of what the Spanish flu, we know that there's a short-term period of time that is about getting people back to work, getting theatres open again, and what does that short-term performance look like? And then there's the medium-term strategy, where at the moment many people are talking about outdoor performance, but our summer term is not that long, and more indoor performance would be wanted around the Christmas panto season, which also links to revenue for organisations. And then what is the long-term impact of this? And from a venue design perspective, for many years we've had crew in the understage bellies of theatres and dressing rooms with no windows and not very nice environments. But actually, I think over the last 10 years or so, we've seen changes to that, and better changes. So what will be the next change which would take an account for these kind of pandemics? And when you look across to places like Beijing, China and Hong Kong that have had these difficulties before, you can see what they've done and how they've achieved a better, healthier environments for their venues. And I think that's something we as an industry, from our perspective, we need to consider even more, I suppose, going forwards, to make sure that everyone feels comfortable and safe in both front of house and back of house, because it's all connected. So I think we will definitely be starting to look at further as an industry how we can ensure that spaces and places are safe and secure going forwards for every aspect of theatre operations.
Yeah, quite right. And so just to give a couple other examples of the thinking around that long medium term, and it's hard because the situation is very fluid. The government guidance changes, the understanding of the science is still changing on a week by week basis. One thing we're doing is we're using pedestrian modeling to play out scenarios based on different straits. What are the flow and dynamics of audience around entrances, toilets, and so forth. And we're hoping that this will help not only the venues reopen, but also successfully reconfigure as that guidance changes. The airborne droplets, significant transmission vector, and looking at what that means for air handling systems, how they can be reconfigured with airflows, filters, UV treatment to minimize transmission. The short-term fix is turn off recirculation. The downside of that is energy use, and I don't want to draw the focus away too much from the short term, which is rightly the focus today. But when we succeed in reopening, I think it's important we don't forget that vital role that our theatre are playing in reflecting and representing their communities, and that the societal challenges which were there before COVID-19 are still there. So, and without repeating the previous session, sustainability, the climate emergency, big issues that need to be addressed in the coming decade. We've surveyed cultural buildings in the Northwest while they've been shut and found very little reduction in power use, which kind of just demonstrates how bad some of these things are. To pull it back to safety, which is what this session is about, I think the safety response, which is exploring thinking about smart buildings and devices for temperature sensing, for ticketing and catering, which limit interactions, and also exploring how groups can share spaces, share physical and digital resources, maybe the sort of thinking that also deals with those long-term challenges. So now I realise I've sort of drifted away from the here and now, and I don't wholly apologise for that, because I think having a vision for where we want to end up is kind of helpful in taking those first steps too. But I think I should probably stop there and let us get the discussion back to the immediate issues.
Great, thanks, Richard and Gary. I want to just capture some of the questions that have been sent to the panel, and one I want to kind of open up to everyone really. There's been a few comments made and a few questions about allowing extra time for fit-ups and for get-outs. Do we envisage that that's going to have to be something that we all have to factor in going forward? Gav, do you want to start with that, and then perhaps we can bring some of the operational people in from around the country as well?
Yes, yes, and yes. At the moment, all of the work we've done there's not been any shows, right? There's no shows on, and we've told all of our guys to just take time to think what you need to do, so you can stay away from each other and do it as safely as possible. But we're not up against any deadlines at the moment. There's no show on at 7:30. So it's working for us at the moment, but I think in the future, yes, we may have to allocate more time and more space for fit-ups and get-outs, which will be a programming issue.
Yeah. You agree with that, Stu? I guess obviously.
Yeah, I mean, I think it's
then production companies. That's going to be a key thing for ATG.
I think as we bring in more mitigations against, against the spread, access to buildings is going to be challenged. But the amount of cohort working will be challenged. So the schedules will be affected. To what degree, we don't know yet, but it's certainly a consideration as we go forward, because, just a simple task of stopping and re-washing hands. The toolbox talks, the information sharing at the beginning of the session is going to increase. Understanding the health of the team on site is going to take some documentation and time. So effectively, yeah, and that's not necessarily a bad thing. We challenge the schedules which we currently have, and they probably with more detail, linking back to what you said around communication and code of conduct before. There's going to be no harm in more detailed production schedules, but yes, there may be a challenge of extended times, which of course brings in cost.
Do you think we could have something similar to what they have in the States, where you have the different crews doing different activities? Do you think that might be a model that we need to move towards, or do you think that wouldn't work too much in the venues?
Well, I think as soon as you start talking about cohort working, it almost goes towards that way. But how that works in practicalities is going to be interesting. But the cohort working certainly is going to be interesting, because yes, you're going to have a team around the trailer. At the moment, the electrics, an electrics department will unload the trailer and move in and go and rig it. It's pretty much your standard. And so when we find, especially as Stu said, the touring is more difficult. You know, when you open the doors on a trailer which has just come from Manchester and you're in Bristol, that brings extra challenges in the containment of and the cleanliness, how we approach that trailer at the beginning of the day. I know in your documents, Gav, you allude to that, that trailer opening, and you must have given that some thought. If because you're on lots, your team will dive in and out and around the country and open many trailer doors, and that's what primarily that's their first function.
Yeah, we kind of see ourselves as the key workers in that, as in if we're the people that are unloading it, cleaning it, and then passing it on to the other departments, that may be a way of as you say, containing, of moving it around. So we don't know what's coming off those trainers, but if we treat them as if they're infected, unload them, clean them, and pass them on to the relevant departments, we think that might be a way of making it easier.
There's already an element of what we do as we work in cohorts, anyway. But it will take a little bit more planning, a little bit more detail in the information what comes through, and how we share that and communicate it on site. And when I talked earlier on about that, it's everyone's behaviour on site. Naturally, it has to slow down for that behaviour to be able to, to share across everyone. If you are rushing at everything, full on, full tilt, and you're completely up, you've got a job which is going to take 6.5 hours, and you've got 6 hours to do it. Naturally, then those behaviours slip. So, yeah, the schedule is going to be incredibly important.
And Stu Beeby, is that something that has been discussed at any of the groups so far? Kind of extra time for working?
Absolutely. Not in specifics, but to Stu's point, one of the key areas that is coming through, of course, is smaller cohort working, so that your bubble, and we've seen that working very successfully in construction. Also, one of the things, and again, nowhere will we be told how to do it in your specific venue or what your capability is that your organization delivers. It'll be a case of what you've got to do, not how. So there's the cohort working, and then, as Emma touched on, you've got those cohorts, and equally we can very much expect venues to probably have maps where teams are in their bubbles, and areas where you have to have crossover, you might well find that there is a designated area where heads of department, leaders, managers, that's where they come together to discuss, because they're people who mix between bubbles, and that will need to be limited. And of course, the things that are being discussed will be very much around ensuring that you don't have swapping going on. You'll be asked to consider smaller cohorts and then demonstrate that you can do that. And so, of course, all of these things add to the logistics. So times to do things, the length of intervals, one-way systems are all things that we'll all need to consider, and we'll need to consider them regardless of where we are on this journey with this pandemic. And by that I mean, right now, social distancing is number one. Well, actually, it's number two. I'm looking at some draft guidance, and number one is wash your hands regularly and don't touch your face. So as Stuart said, we're all, everybody's going to have to add time for all that washing of hands. But, there is this piece of, we've got to be looking at the activity and the time involved in what we do. And that is very much being discussed. But one thing to pick up from in a lot of the chat that's going on, and it's right, social distancing, whether it is even down to 1 meter across our industry in its broadest sense, broadcasting, some of the great things that people have been able to do and stream and are continuing to do, in the main, with social distancing, even at 1 metre, 4% of our sector could go back and possibly make it work. We've got colleagues who, I don't think they'd mind sharing, but the VE day that was broadcast was something like 3 times as long in the planning and 3 times the cost. That is not sustainable for anybody. And I'm sure Emma has got to have a sharp pencil out when she's looking at all the things she's doing. So one thing from the chat that's coming up is, a lot of these things where social distance is required, a lot of you can't do it. And you, like construction, you are going to be working together inside 2 meters. And, in construction, there's a lot of PPE being worn that makes the task more arduous. And then suddenly that means there's a 15-minute limit on how long you can do it. And because of that impact on the industry, and as we know, you can't run an auditorium and a performance with that sort of social distancing in an auditorium, and that's stopping the return to work. So what's the takeaway? The takeaway that the number one for our sector is that, our mitigation has to be almost in lieu of social distancing. As we know, there's a lot more science coming out in terms of the face-to-face reaction, and the alongside or back-to-back is better. And that's where we need the scientists, and that's where we need to understand things more, because social distancing for our industry is a challenge. And then, if I may, Phil, just indulge me, a lot of the chat about people being represented, because it's such a good point. It comes up every day to those that are asking who's representing the little guy. These groups need to be big enough to get to a solution, or it becomes like herding cats. Believe you me, some of the groups are already 60 people trying to meet over this forum, trying to collaborate, coalesce, and get to what is a cleaning regime, what is a standard that we could all clean to, for example. So it's a real challenge to have everybody represented, but there is a significant representation. But what has been picked up is, of course, that whilst they might not be represented in all of the working groups that many of us are sat on, what there will be is a period of consultation where the guidance, before it is signed off by government, will go out further to many of the associations that I've seen in the chat are being discussed, and trying to get it out there, so that I guess that the net is thrown as far and wide as is humanly possible, whilst trying to get to a decision and get us to that date we all want of being able to open not before this date, which is key, because that's what we all want. Thanks, Phil.
Okay. There's been a couple of other questions about training. Is this a new training regime that we need to start introducing into venues? Obviously, that may become mandatory along with first aid, all those kind of things. Are we going to have to start focusing some time and resources into COVID awareness training? Is that something we think we'll need to focus on?
Can I just pop in here? Emma, you mentioned that some of your technical staff had to take a safety video or something to come in, and that, I think that was that, I can't remember if that was a thing or not.
We were planning to do that, but this also goes into the same thing with schools. Not everybody has the same access to technology. So not everybody's got something that they can view those things on and participate in those things. So we've not done that. And instead, it's an on-site briefing when you get to work, rather than do it in advance and tick a box on the internet, because we're not doing that. We're doing it face to face.
Okay. And anyone else, kind of, Tom, is that something that any of your clients have asked about in regards to kind of preparing crews and staff for kind of reopening?
Not specifically at the moment. I think there's 2 elements to it. The first is that the induction process, the site briefing that should happen before the shift or before the people start work, should really only be considering the specifics that relate to that next period of work. The core skills that they should have in relation to the broad working environment should already have been covered by some other medium. Otherwise, why are these people turning up at that point? To me, it's not it's not an appropriate use of that time on site before a shift to cover information that is generic and should be provided in another forum before they get to that stage. I would expect to only be including the location-specific arrangements that they might not be aware of, and any site-specific rules and requirements in that. So from an organisational point of view, a company could be delivering that training in any way that suits them, really. And every employer will have a different need there and a different solution to that. I would be trying not to include it in the site induction, other than for people who are visiting workers, if you like, that have no other means of being given the relevant information and trained in it.
Just to clarify with us, there's a lot of information that you've had to do beforehand, but it's on site, it's within your cohort. You do a briefing within your cohort specific to your tasks that day.
Makes perfect sense.
Yeah.
There's also been a few comments made about facilities backstage, and obviously probably for front of house areas as well, for hand washing and all those kind of things. I know obviously from experience, a lot of venues have got rid of some of those possibly when spaces become quite tight and adapted spaces into dressing rooms and those kind of things. Do you think from a kind of capital projects initiatives, do you think that's something, Richard and Gary, that will have to be kind of reincorporated back into any refurbishments or new builds going forward?
It certainly changed the picture, and it's another one of these questions of what's short term, what's medium term, what's long term, and right now, as I think Stuart said, hand washing number one. But unfortunately, our timescale on the building projects tends to be looking 3, 4, 5+ years down the road, and as you say, we've seen all the hand basins taken out to make space for toilets, and it's an interesting reversal. I think some of the temporary solutions are possible. So go on, Gary.
Sorry, go on, Richard.
I was just going to say that it's the sort of thing that potentially you can do on a temporary basis to give the hand washing facilities for people who want to do that on arrival. That can be part of that quick solution rather than something that's something we have to build in for the ongoing future.
I just think with regards to facilities, I think the end goal is that we will have full audiences. We are going to have full theatres again. We are going to have thousands of people in a room together. That's the end goal. That is going to happen. We have to have confidence that will happen. What we recognise is what those changes to venues, whether they be current venues or new venues, there's going to be some adaptation required. You know, a West End venue is a West End venue. You're not going to find any more space suddenly within a West End venue to add in new toilets and bigger bars. I spend a lot of my time being challenged to do that and never winning that challenge. But whatever changes we need to create to venues to consider a more safety environment for this kind of reason, it needs to be practical, it needs to be cost efficient, and it needs to be doable quickly. And I've used the toilets, the glamorous conversation of toilets quite a lot in recent conversations, is what can we do in venues to make the toilets more COVID secure? Is there a traffic light system that gets you in and out of the vestibule so you know how many people are in there? Do you use foot handles rather than door handles to be able to open doors? Do we add cistern sinks to toilets? So automatically you increase the amount of toilets that are in a toilet block, so you reduce the amount of touch points and the bump effect. How do we ensure that people down the corridors are 2 meters apart? Do you put them on the handrails? So there are all these little things that I think we as an industry can make small changes with huge impact. And when you look across to China and Hong Kong, you can see today, some 13, 14 years later, there are stickers on handrails which says this was cleaned 2 hours ago. And that's a direct impact from SARS. So there are these elements I think we need to consider in facilities design and implementation for both existing building and future buildings that need to be effective and useful. They can't be a hindrance or help. And I think that goes across the entire industry, whether you're a technician a lighting operator, we cannot hinder your work, so otherwise it just won't happen. You know, conversation about production desks during Tech Week, you know, infection is increased by sustained time together. So at Tech Week, we have all spent many hours, many long days sitting at a tech desk, all pinching each other's quality streets out of the box that are kept on the table. Is that the new norm? Should there be screens on the tech table? Should that be something that is implemented straight away and something that stays for a longer period of time? So I think we should be looking very much at the practicality of change in venues to ensure that people actually implement them and they are useful for the industry.
It's just something simple. I've seen over the years is screens that used to be in box offices have been removed to make them feel more open and welcoming. Perhaps that may be something that has to be reintroduced, obviously in light of obviously the issues we've been talking about. There's also been a few questions which perhaps Emma and Stu, you might have an input in regards to kind of wigs and costumes and some of the other departments that have to get very close in contact with performers. What kind of procedures or protocols do you think we have to put in place to protect those workers?
I was just about to type something like that actually. This month, these next 3 events that we've got, these 3 Saturdays coming up, there's no makeup. You do your own, you dress yourself, you place your own mics on yourself. We've got broadcast mics for the singers, and those are done under direction, 2 meters distance from a technician that instructs them. Going forwards, that could be months away. So I don't think we're going to be spending time creating protocols right now for something that will happen in 6 months' time, and the life will look very different than it does now. But for now, in an abundance of caution, we just are not doing those, and people will do them themselves. At the very outset, I know that first week we went home, we started talking about face masks for dressers and things like that, but that's a consideration in a few months' time when we pick up properly and we start doing performances properly.
So, I mean, yeah, it's really you're really close to close quarters in that work, and the cleaning regime is absolutely integral. But if you look at what they're doing with a Phantom, they've got a good video, I think, of showing how they do it backstage, and they've got full makeup and full wigs, and they show that cleaning protocol. It's still to be put out, but it has been seen to work elsewhere. But that certainly is a challenge, and how I think the broadcast world will come back where makeup's being done by themselves at the moment.
Okay, there was another one for you, really, Emma. Was it regards to the distancing for all the singers? Is that something that's a scientific distance, or is that something that the Opera House have worked out?
I'll get the guidelines for that. I just sent an email over to the health and safety team, just so if I can get a proper link for everybody for that one. Okay. I've sent the documents over to Alicia so that they can be shared as well.
There was also a kind of more practical question in regards to something that we hope never happens in venues, but obviously if we have to do an emergency evacuation, how we plan and organise that if we've still got social distancing in place. Has anyone got any thoughts about how that might work in a practical sense?
Yeah, well, our guidance for this weekend for evacuation or invacuation is that you adhere to social distancing, and also it's not a very big team of people there, so were we to evacuate, we could be in the street quite easily spaced. But were there to be a fire, then that would obviously take precautions. So yes, maintaining social distancing is what we would currently do, but not to the detriment of your good health in other respects.
I suppose that's come out of as schools have gone back as well. That they talked about the evacuation of children from the school premises, and that's exactly the same social distance maintained. In the event of something like a first aid incident where you can't do that, of course, there's a need to go up and tend to the child.
Another question I wanted to just ask the panel about. Obviously, some of our venues are multi-use or multi-purpose. Some might even share buildings with libraries, other kind of things. I know some venues have got cafes and restaurants. Are we looking do we think to reopen those kind of things sooner rather than later, or do you think that will be a gradual thing that might last into later into the year as well? Stu Beeby, perhaps, because I know some ATG venues have got restaurants. Is that something that you're looking at?
We are, but Phil, you're right. In the main, most of our other spaces, like a restaurant, and I think of our theatre in Torquay that's got great fish and chips on the seafront, but most of our spaces are reliant on some form of support from the theatre, life safety and the like. So I maintain this line with them, that if they can open and be commercially meet COVID secure guidance, as it would be for a takeaway or something like that now, and they can be commercially viable, then of course we would look at doing it as those dates allow things to open. But the truth is, we can rarely make it commercially viable because they usually are dependent, for the very least, many of our spaces need the life safety systems of the theatre. So as soon as we start bringing in stage door and water management in the theatre and so on, which, as we've all touched on, we're all doing venue inspections, but our theatres are turned right down. Interestingly, about the energy that Richard mentioned, just want to be we've got a 85% reduction on electricity and gas, just wanted to say that, but whilst remaining safe and secure. But yes, Phil, our issue just becomes one of practicality. Whilst we look at it, we've not found yet any one of them that can be commercially viable under current requirements, because they're too dependent on some sort of support from the theatre. But that's just peculiar to our 49 venues.
Yeah. There's also been a question about new, younger people coming into the industry. What kind of words of encouragement can we give them in regards to the future of their careers in theatre? Anyone got any comment or opinion on that?
Only that in my 25 years in theatre, we've adapted. This is the biggest thing we've ever had to deal with, but theatre's always adapted very well. So when we are up and running, there will be an industry. We all have to believe there is going to be an industry, and that there will be a place for them in that industry. At the moment, none of us here can tell anyone what that is. But we all sit here and we're all working as hard as possible to make sure there is an industry for them when this is all done.
Yeah, and Phil, we'll be back. It's as simple as that. You know, we make people smile, we make people think. What we do makes us, you know, it enriches the world. Why wouldn't anyone want to be part of that industry? You know, whilst this is the first time theatres have closed, we all know they didn't close for, you know, Spanish influenza or 2 world wars. But, you know, we've seen it's not been a Hollywood disaster movie. We've gone out and clapped for carers. We've dressed up as dinosaurs and sung down the street and so on, you know. We'll overcome, we'll figure it out. And when we're back, as I say, our industry makes people think and it makes people happy and laugh. So who wouldn't want to be part of that? It's much better than pushing widgets around in an Amazon warehouse, isn't it? Sorry if anybody is. I get a lot from that, of course, you know. But
I think there's more on that, because we're talking about buildings, by and large, theatres that are existing buildings and have a fixed auditorium. But there's a huge scope outside of that for multi-purpose venues that have just 4 walls and a roof, maybe not even a roof. And certainly my involvement in the industrial theatre sector, we are designing the room layout for every single job as a bespoke thing to suit that particular production. And that may be a fairly common layout because everybody's priorities have been to optimize the number of people they can get in the room for certain criteria, whether it's sales, product launches, or whatever else. But it's very, very easy within the existing well-established model to incorporate any sort of other criteria that need to be put in place to stage a production, not just an industrial theatre show, but any sort of creative arts event. So those multi-purpose venues, those 4-wall environments and the outdoor environment provide us with huge scope for producers who aren't tied to a venue to still be putting on shows that make people smile and laugh and all those other things and cry. So in that sense, there are huge challenges for the existing built environment, which didn't have to consider these things, but there is also huge scope for the flexible environment to accommodate these things much more quickly. And I would see that as a real opportunity for not only those that are coming into the industry, but people already here.
I think I'm going to have to support that, Tom, as well, is that from a design point of view, over the last, particularly the last 10 years, there's been a huge desire for flexible venues and flexible auditoriums and stages, because the artistic creation is demanding more than what the four walls can give. And so we're seeing a lot more transportable venues and transferable venues, which then links into our other part of our industry, which is live events, and all of that connects to the industry that I know so many freelancers move around so much. And there was a conversation I was in the other day with a group of, actually should theatres, particularly new venues or venues that have space around them, start to reach out to their external areas. So if this came up again, it's the resilience of theatre. What are we going to learn from this? So could we be able to encourage venues to make use of their outdoor spaces and have that as the backup? So if this ever did happen again, is it a shorter period of time rather than a longer period of time? And I think there's also a good question. So I know one of the questions was about touring particularly. I think one of the benefits that will come out of this and how we can encourage people to come into our industry is the more regional development of productions rather than the reliance on the touring productions. Now, Stu Beeby is probably not going to like this because they went too much from an ATG perspective. But I think those smaller organisations and the more regional organisations like Nottingham Playhouse and Leeds Playhouse back as it's called today, I think more local work and more local support from their community will, I think, be amplified more so than ever. And I think that's really encouraging to look forward to in our industry.
There was a question, probably Gav, you might be in a good position to answer this one, about linking in with the haulage firms and other companies that we work with. Is this something you've kind of engaged with at this stage, or have you shared your documents with any of those?
No, not to my knowledge, sorry. We haven't really spoken to anybody from any of the haulage firms, or we've worked through producers, we've worked through production managers, and we've worked through venues, but we haven't actually spoken to anybody from any of the haulage firms, I'm afraid.
Okay, that's fine. I'm just trying to whiz through some of these questions, so bear with me a second. Regards kind of mandatory and statutory testing, is that something that we've all been continuing with going forward? Can we see any changes in that, or do you think the regimes will stay as they are? Emma, do you want to come in with that?
Yeah, sure. We've kept up all of our testing. I mean, not pattern testing. We haven't had the team in doing all of the loose kit, but all of the sort of stage elevators, lifts, things like that, we've kept to our regime. Partly because you need to be ready to go back in. Partly because that's the advice, and partly because you don't know if those people are going to be available when you're all suddenly able to open. So no, we've kept to the same regime. Also, if you're doing it in your dark period each summer or whatever you have, then it's just going to kick it out of kilter if you don't do it now. So we've kept up with it. Not everyone has, I would appreciate the funds to do that. So that's, I'm sure that's a consideration for organisations. There was also something in there. Meg.
There's a lot of, we haven't touched on anything to do with the audience. There's been a few audience bits and pieces. I appreciate that. I've been trying to let people know that we're following government guidance at the moment, and of course we can't open. But I just wondered, has anyone on this panel begun to thought about the notion of opening, but only having an X amount of capacity?
I could speak to that if you like. I think in common with most venues, apart from the occasional pop-up things, most of our funding, we've been very proud of the fact that we've reduced our reliance on funding, Arts Council funding, those of us that get funding over the last decade. It's still the vast majority of our income is ticket sales. So I'm sure we, like most venues, are saying we can't open until we can get near capacity. It's not economically viable to open 20%, 30% audiences. It's just not. Unless everybody pays £300 a ticket, it's just not going to happen. And then how do you manage toilets, queues,
And that's the view we're seeing from ISPA as well, the International Society of Performing Arts. It's all kind of waiting for a vaccine to kick into that. It's the social distancing which is the real big challenge. And I think going back to that conversation earlier about the multi-purpose venue and the other spaces, to some extent that can unlock maybe some of the space that we haven't got in foyers by reusing the restaurants, the black box studio to maybe soak up some of that, provide some of that capacity. But when you get in the auditorium, the social distancing is killing it. And Denmark's got some interesting guidance which allow a closer seating with face masks, which is what's been happening in South Korea as well. So maybe there's a path there, but until we get some good guidance in place, it's difficult to see a way through that.
There's also the fact people are saying, what about backstage? We're in cramped accommodation, we're in cramped dressing rooms and cramped corridors. I think if we can't do it for our audiences, we can't do it backstage. It's across the board. You can't have, it won't be a two-tier system. It absolutely can't be. Yeah. If our audiences are safe, then we must ensure everybody backstage is safe.
Yeah, there's a number of facts I think we're all trying to we work through. So stuff coming up from the producers, West End, Broadway, and regions. Obviously, there's a variable here, but the rule of thumb is investment in productions. They need to be having an average occupancy of 65%. I think most of us have modelled a 1 metre social distance. I think gets you to about 50% occupancy. So performance to a live audience. I go back to social distancing. We have to have other measures, and we need to understand how the virus is moving, as opposed to controlling it through just social distancing, which is a big part of the work we're doing. And then when we do talk about social distancing, and you look at queues for customers, if you said, okay, we're going to do social distancing, look at what happened with where Heathrow came up with, a 747 carries about 400 people, and you end up with a socially distanced queue of 1.6 miles. So just think about what that's going to look like, snaking around the Liverpool Empire or down St Martin's Lane in the West End, and so on. So you can see there are just some things that have to move, that there is no point as trying to overcome. As it said, we need the time, and we need those things to change, really, because you just can't deliver on that. And as many have said, cramped back of house spaces, that you there's no way you can set a one-way system, and so on.
And obviously, just when I touched on right at the introduction, queuing systems, counter-terrorism issues and the risk of terrorism hasn't disappeared, and we obviously need to be factoring those kind of things in when we're queuing people outside of buildings. So there's lots of implications that we need to be thinking about with the social distancing for obviously for audiences in particular, but also for our crew and staff. I'm just going to whiz through some more of the questions. There was some comment on some of the questions about new responsibilities for stage managers and company managers. What do we feel that there will be some extra role responsibilities that will fall onto some people's shoulders in the new reopening of venues? Emma, have you got any comment on that?
Yeah, I could see that. I mean, I could understand why we've put in this monitor system over the weekends. You've got senior staff who are therefore accountable. But yeah, I can understand the concern of stage managers, because they're there from, in every single aspect of the show, all the way through rehearsals, at production desks, on stage, and the fact that they're concerned about having to police everybody is a very real concern as well. And I think as organisations, venues, producing houses, companies, we need to think about how we support them and how we put in place, those checks and measures. Also, the mental health stress that will be on those people to take that responsibility and be responsible for sending somebody. Do they send somebody home? Do they not send them home? Are they more senior than them? Are they more? Should they say something? Are they putting other people at risk? I mean, there's a huge amount of pressure on those people. We should definitely think about it.
Yeah, I agree. I think the company managers, the stage managers, are going to have a lot more responsibility, and they'll be on the front line of making some of those tough decisions.
I just wanted to double check, guys. I'm just setting up a platform on the ABTT to share some of these documents. In the documents you sent through, you're happy for those to be shared. And Gav, can I just check you're happy for the Pirate Crew one to be shared on there as well? Perfect, thank you.
I think we're getting close to the end. I just wanted to quickly kind of ask the panel if there's anything innovative that we haven't touched on yet that we all need to be starting to think about in regards to what our venues need to consider for reopening. Anyone like to kick us off with that? Go on, Stu. I'm sure you've got some.
I think, you know, those from a venue point of view, you know, the teams in the venues know the venues inside out. So there's going to be some, you know, these broad brushstrokes of guidance around. There's going to, you know, around distance, cleanliness, welfare, how people go in and out, cohorts. It's going to need some thinking about early, you know, and they're difficult. We've already said these spaces are difficult. So being able to sit down and think through those and start document them early, and then being able to go on site, well, you know, when you do get back onto site, to start working those through before the first phase of rehearsals will come back in and come back into the venues to start testing those backstage areas is going to be really key. So getting your early thinking caps on as a manager of a building, and really thinking what you can do, which is reasonable inside. I mean, how you share facilities for the build stage before you go into rehearsals. You know, it was Gary who said, you know, shared facilities and builds of the future will be useful, but actually we need to do that now. We need to use those facilities we've got, because there's not going to be a magic wand which is going to come out and change that overnight before we start rehearsing back in the building. So we've got to be creative. You know, we've got to go out there and make those broad guidelines work inside the venues, and that's what we do. We make things work, and we will be back on site using our venues, and they will be full again.
And I think, Stuart, just to really touch on that and previous statements, is that our venues are going to open. We are going to be putting on shows again, and we are going to be working our venues and looking at all the questions that are coming in. There's such a broad spectrum of venues and operations, from small venues to the large venues. And I think what's really important is venue operators and users do sensible changes to the venues that work for them. And I think using the guidelines to help support that process, and anything that people do, whatever kind of venue you're from, there should be some sort of open source platform for us to be able to share what people are doing and where. I don't know what that is, but I think this is a moment for our industry that should really come together and support. And if there are really good strategies and approaches to whether it's small modifications to a box office screen, a screen for the ice cream attendant, or whatever it may be, I think all of this should be able to be filtered through an open source platform. And I think that's the way we can all share the diverse range of differences across our operational platforms to ensure a successful reopening to work. And without difficult costs or huge changes to operating venues, whether it be production staff or performance staff. And I think that's really important for us as an industry to talk to each other now more than ever.
Yeah, absolutely. And that's what, you know, something like the ABTT allows to happen. That's, you know,
absolutely,
it's an incredible platform.
I think we've been doing that in the background. I think there's dozens of documents being shared during this discussion, and I think, you know, the ABTT is a great forum for us to keep doing that going forwards, and hopefully some of that information will work its way into some of the working groups, and hopefully that will give us the guidelines and procedures going forward to reopen safely. Meg, I think we're just about out of time.
We are. Alicia and I were just saying that we were happy for you to overrun, but you are ever on time, Phil. So I was I've been chomping at the bit to finish. I can't thank you enough. I've been sat at home desperately wanting to know what's going on, and so it's been an honour to host you all in the same room. I know that there are a lot of people at home wanting to know what's going on. it was all of our intentions when we had a couple of pre-meetings for this. We're not going to have all of the answers here at all, but I hope that that's given you a bit of that's the best I can do, is pull all of these people together and try. And you know, there's stuff going on at the Opera House. Gav's out there doing work, they'll keep doing it. All that we can do at the ABTT is encourage everybody to share documents, keep working in working groups together, and at the ABTT it is our aim to facilitate and make this happen for you. So I think we all agreed, didn't we, in our last meeting, that this was probably the beginning of something where we all stick together in this and continue talking. You can see that they're all prepared to share their documents. I've had some lovely messages from people who are also doing working documents, and they would like to share it with you also. So we'll facilitate that at the ABTT and make that happen. So you know, maybe this is the first of a few discussions as we try to find our feet going forward. So it just remains for me to say thank you very much to everyone on this panel. It's a daunting task to come and talk in front of, we think, about 600 people across the Zoom platform and Facebook. So let's not forget our Facebook friends. Thank you very much. There's about 150 of you viewing on Facebook. So thank you very, very much for joining us. I'm just so glad that I worked the buttons out for you to come and join us. So there are a few people that we need to thank. David and Alicia have been my backstage team on this. So turn your videos on, guys, and thank you. So Alicia's been my right-hand girl for 2 days worth of Zooming, yeah, I couldn't have done it without her. So it's also really important that I thank the Guildford School of Acting and the University of Surrey, who've lent us the very expensive Zoom webinar package, so that we could host this many of you today. We wouldn't be able to do the live streaming without it. So it just remains for me to say today's session has been brought to you by the Association of British Theatre Technicians. We find ourselves in strange times and our industry is very much closed. Our hope with these events was to bring us all back together in a room to brainstorm and discuss. Our trade organisations more so now than ever need your support. And if you'd like to know more about how to join the ABTT as a member, a link has now been put in the chat for you, or you can just go and have a little look at our website. We've got a wide range of different memberships for students and entry-level people as practitioners. And we would wholeheartedly welcome you to participate and support and join us. Being part of the ABTT is like joining a family, and I can't advocate that enough. You can join in as much as you want or not. We also have a donate button in the drop-down menu of our website if you'd like to support the work that we do further. So it just remains for me to say thank you very much for joining us today. We wish you all very well, and we hope to see you all very soon, perhaps not on Zoom in a little box, perhaps at the show next year or in a venue, up a ladder, whatever. But thank you very much, and we hope to see you soon.